we're going to go ahead and listen to the heart and lungs on Rex. We do want to go ahead and listen to all the quadrants of the heart. You can do that by just making small movements, increments of movement on each side of the chest. And then same with the lungs. We're going to split it up into 9 quadrants and try to listen to all the areas of the lungs. We're going to go ahead and also check that the pulse and the heart are beating at the same rhythm and intensity. So we'll go ahead and start with the heart, and then we'll also get the heart rate and respiration rate. So for the heart, we're listening for any whooshing that may indicate a heart murmur. And then listening for any abnormalities to the rhythm of it. Dogs can have sinus arrhythmia, which means that the heart rate will increase or decrease with the respiration. So we'll go ahead and get his heart rate. Okay, so I counted 19 beats in a 15-second interval, so we would just multiply that by 4 to get 76 beats per minute, and we'll check the pulse with the heart rate stay. And they are matched with intensity and rhythm. And then we're going to go ahead and listen to the lungs. For the lungs, we're listening for any wheezing or cracking. Good boy. Stay. Stay. Good boy. Go and get his respiration rate. Stay. We'll go ahead and get his respiration rate. So I heard 6 breaths per minute. So 6 breaths for 15 seconds. So I multiply that by 4, and therefore we get 24 as for respiration rate. As far as the lung sounds, we are looking for any wheezing or cracking, depending on sometimes the intensity or the pitch of the wheeze. It can indicate whether it's upper respiratory or more of the lower respiratory infection. So any abnormalities we would report to the doctor and have them double check the heart and lungs.
We're going to go ahead and do an ECG on Lexi. We do have her on a couple blankets to separate her from the metal table, and that does help reduce any kind of artifacts on the ECG. Once we place the leads, we'll go ahead and apply some alcohol and electrode gel, which also helps reduce any kind of artifacts. So we'll do the white on the right front, the black on the left front arm, the red on the left rear, and the green on the right rear. So we'll apply our alcohol.
When you get done, there's a bunch of food down there.
And our gel.
There's one in there, Willowy, let me tell you. Something about she's trying to increase medications.
And then we'll go ahead and start the ECG.
It's due for its 3-month TPLO x-rays on the 22nd of this month. So keep that in your mind.
So we can either increase or decrease the size of the screen here in the ECG so we can better reduce any kind of artifacts. And then as of right now, we are having a normal heart rhythm. We'll go for at least 3 minutes. If there's anything abnormal, we may extend it, but we should see kind of any abnormalities in that amount of time. So what we'll do is she does happen to be breathing hard. Sometimes you can put a hand on her chest to help reduce the movement of the chest if you're getting an abnormal reading on the ECG. And then once we're done, we'll go ahead and stop the ECG, and then either send it off to the cardiologist or just give it to the doctor. And then we'll just remove the leads and then wipe up any residual gel. So I'm going to go ahead and demonstrate how to use a rabies pull. So for this one, in order to retract or tighten the hoop, you're going to go ahead and use the end piece here and pull back. And then you twist to the right and it locks it in place. So we'll use this if we suspect that the dog has rabies or a really aggressive dog. This one obviously is not aggressive, but we'll go ahead and hoop it through and then pull it tight and then twist it to the right to lock it in place. And then now I can direct him in the location that I need him to without chances of getting bit. Rex. And then to release it, you'll just twist it to the left. Good boy. There we are. So I'm going to go ahead and show how to collect a urine sample free catch on a male dog. Come here, Rexy. Come here. So we want to go ahead and catch it midstream. So then that way any bacteria that may be at the tip of the prepuce is already out of the system before we get our collection. Come on, go potty. Come on, go potty. Go potty. And there we go, we got our sample. We will go ahead and put it in a sterile syringe and run our urinalysis. So I'm going to go ahead and disinfect a kennel. Here I have a solution of dual quat, and so the disinfect time for it is a minimum of 10 minutes. So I'll go ahead and spray the kennel door. And then spray all sides on the inside of the kennel. Making sure I'm saturating it all. Then I have my timer here for 10 minutes, so I'll go ahead and set it. Come back and clean it. So our timer is about to go off. So I'll go ahead and respray. Okay. I will respray the kennel just to kind of loosen everything back up. Okay. We'll go ahead and start with the door. It's the cleanest. go ahead and make sure and do all the sides of the kennel, including all the corners. And then last, I will do the bottom. Again, making sure I get all of the corners, especially in the back. Alright. And then I will let that dry before putting another animal in it. I can do it all. Alright, so I'm going to go ahead and take out my sterile gloves. And then this is going to be my sterile field. So I will get my sterile lube. Sterile syringe, and I'll drop it here. And then I have my 3.5 inch polypropylene catheter. And then I will go ahead and scrub up the prepuce before I get on the sterile gloves. And then I will go ahead and have somebody hold out the penis, so pull back to the prepuce. Go ahead and get all my gloves. Get my catheter. So I will fold it up in my hand so it's not touching anything else. I will lube the lube on the distal end of it. So I'll go ahead and feed in the catheter. Shouldn't feel any resistance. I'll get my sterile syringe. Collect our sample. And slowly pull back the catheter. And dispose of this, and then I'll put a fresh needle onto this and put it into a clear top test tube to send to the lab. So we're going to go ahead and perform a cystocentesis using an ultrasound. So we'll first apply some alcohol to the area. Place our probe here and locate the bladder there on the screen. Get our cysto needle. You can see it guiding in. Draw back, get our urine, go straight back out. And then we'll put this in a clear top test tube for your analysis or culture. We're going to perform the Schirmer tear test on Rex here. So we have our strip here. What we'll do is, before we get it out of the package, we will bend it. We'll bend it here. And then what we'll do is we'll place this in the lower eyelid, and then we'll let it set for a minute. It's okay, Rexy. Good boy. And we'll just go ahead and close the eye, and we'll wait for a minute. Good boy, Rexy. It's okay. And it's okay that he blinks, we just need to make sure and keep the strip in the eye with the eyelids closed. Good boy. Okay. Good boy. And we have it at 12. So with our Schirmer tear test, we did get 12 on our strip. However, he is an older dog and he's not showing any signs of KCS. So the client would just monitor and watch for any progression. So I'll go ahead and apply the proparacaine to the left eye. Good boy. Then I need to calibrate. It's okay, Lexi. The equipment and turn it on. Okay, it just says calibrate. Okay. Now it's saying that it is good, so you can go ahead and start the test. Okay. Good boy, Rick. So go ahead and gently apply pressure, touching the equipment to the eye until I hear a beep, and it is saying 12.
With minimal air.
So we're going to go ahead and do a fluorescein stain. We have all of our stuff here. We'll start with proparacaine. So we'll go ahead and just place a single drop in the eye. Good boy. We'll let that sit for a few minutes to take effect. Good boy. So we have our test strip here. So what we're going to do is go ahead and place a few drops of the eye wash on it to moisten it. Then we're just going to gently touch this to the eye that we are testing. Good boy. You can see that the green stain is now moving throughout the eye. And then so what we're testing for is any kind of injury to the cornea. So this stain does not attach to any healthy tissue, it just attaches to... It's okay, buddy. It's okay. It's alright. Just any abnormal tissue of the eye. Good boy. I know it feels funny. So we just need to go ahead and flush out any of the excess stain. It's okay, Rex. Good boy. Good boy. Yeah, I know. Good boy. One more, bud. It's okay. Good boy. And wipe out any mucus that may be in the eye as well. So we'll go ahead and dim the lights. Can you see this?
Mm-hmm.
Yeah.
Yeah.
Okay, and then we'll go ahead and get our black light, and then we're going to check the eye, and you can see that there is no uptake on the cornea itself. This is just the residual fluorescein stain. So since there is no injury, that'll indicate different medications that we can use. And then we'll just flush out any excess stain now. So I'm going to go ahead and express the anal glands on Poppy. I have my lubricant, my spray afterwards, and then my paper towels. So I'll go ahead and get some lubricant. And the anal glands are located at the 4 and 8 o'clock position relevant to the rectum. So you just want to go ahead and put your finger behind the gland, and then you just want to gently milk it out. It should be a nice the consistency of it should be relatively liquidy. We are looking to see if there is any blood, or if it is we are looking for any blood, or if the exudate is clay-like. Go ahead and do the opposite side. Okay. That's looking like a good consistency. So we'll go ahead and just clean her up. Give her a little spray. There we go. Okay, so we're going to go ahead and prepare a solution as if we were going to do an enema. Lexi does not need one today, so we'll just prepare the solution. So we have our canister here, and we do have some lubricant here for the tip of the tube. And then we have our soap that we're mixing with our warm water. You do want to make sure that the water is warm. It's not too cold, and then obviously not too hot to the touch. So we'll go ahead and start filling our canister, and then we'll add our soap to it. Making sure that our tube is kinked off here. Once we do have our solution here in the canister. So what we would do is we would normally take her outside. We would put lubricant on the end of the tube. Somebody would restrain the dog and put the hand underneath her back legs, making it so then she cannot sit down. We would have a second assistant go ahead and hold the canister of our solution. The technician or doctor would insert the enema. Sometimes you can run into a fecal ball, so what you would do is just kind of massage it back and forth. The second assistant would go ahead and raise the canister up, and then you're going to use gravity to just allow the solution to run out of the tube. When the technician or doctor is ready, they'll go ahead and unclamp the tube, and then allow the solution to flow through. And then typically we'll try to walk the dog outside to see if they will pass any kind of fecal ball that may be preventing them from defecating properly. So we're going to go ahead and apply some topical flea medication for Ruckus. This is Revolution. So all you have to do is press down on the cap and it'll puncture the top. For cats, you do want to make sure and put it high up on the back of the head so they don't turn around and lick it off. And then you'll just go ahead and part the hair so you can see the skin. Go ahead and apply all the medication in that one spot. Oh, it's okay, bud. And then that's it. That's all you have to do. And then it is good flea control for 30 days. So we're going to go ahead and clean Rex's ears. So we have our cleaner here, which is Deloxo, and then we have our cotton balls, and then if he had an ear infection, which he doesn't, then we would go ahead and apply an ointment similar to Modazole. And so what we'll do is we'll start by holding up the base of the ear, and that way it opens up the ear canal. We'll use our solution and fill up the ear canal, and then once it's full, we'll go ahead at the base and swish it around and get that cleaning action. Then we'll take our cotton ball and gently wipe away any debris or liquid that does come out. Oh. And then what we'll do is we'll go ahead and take our ointment. We would typically, again, hold up the base of the ear, apply the correct amount of drops per the doctor's request, and then we'll go ahead again and massage the ear. And then we would wipe out any remaining ointment or smear it on top on the inside of the ear. And then we would repeat that to the other side. So we're going to go ahead and clean the ears on the cat here. So for this cat, what we'll do is go ahead and wrap it up. So then we're not at risk as getting clawed. And then it's also easier for us to restrain the cat. So we have our ear cleaner. And our ointment, medicated ointment. For cats, usually about a half a cotton ball is suffice. So what we'll do is we'll take our cleaner, lift up the base of the ear, fill it up. Good, kitty. Get at the bottom here and swish it around. Go ahead and take our half a cotton ball, gently wipe out the inside of the ear. Since it is relatively clean and he does not have an ear infection, we won't be applying this, but if we were, we would go ahead and put the desired amount of drops in. Again, massage at the base of the ear, and then wipe out any remaining ointment. And then be careful because they will shake at the end. And then we would just repeat it for the other side. We're going to go ahead and administer some subcutaneous fluids. So what we're going to do is go ahead and get some skin here around the shoulder blades. We'll make sure our bevel on our needle is facing up. We'll make a tent. And then right here at the base of the tent, we'll insert our needle, hold it in place, and then we'll open up our line and seeing that the fluids are running properly. So what we'll do is once we are done, so there will be a lump here where you are administering the fluids. It can rotate, so make sure and warn the clients if they're going to be taking the animal home. But it will be absorbed throughout the body in the next couple hours. So once you're done, go ahead and close off the line. You'll pinch at the base where the needle is inserted, and then go ahead and remove the needle, and then continue pinching off the skin for a few seconds to make sure none of the fluid leaks out. So I'm going to go ahead and trim nails on the dog. So I have my quick stop here in case we get a little too close to the quick and it does start to bleed. We have our nail trimmers. So with the dog's nails, you can sometimes see the at the bottom can indicate on how far you can go. Otherwise, you just pay attention to the texture of the nail itself. You'll notice that you'll get the little black dot in the center. That's an indication that you're getting closer to the quick. Texture of the nail changes and you move on to the next one. There's the black spot in the center. There we go, right there. That lets us know that we're getting close and we need to stop. Okay. So I'm going to go ahead and perform a nail trim on a cat. I just have my nail clippers here, and then I have some quick stop in case I get too close to the quick and the nail bleeds, but we are going to try to refrain from doing that. So with kitties, usually less restraint is best. If you go ahead and go underneath their pads, it does pop out their nails. And then there is, you can, it's hard to see here, but you do have, most nails are clear, so you can see where the quick starts. But typically you just need to come in and take that hook off. Some kitties do have extra toes, so you do need to make sure and clip the nails correlating to that toe. Usually they tend to be in here, in between the dew claw and the second digit. It's okay, kitty. And there we go. We got all the nails on this foot. I'm gonna go ahead and apply an emergency bandage. She obviously isn't in need of an emergency bandage, so I'm not gonna actually apply. But if she did have an open wound, we would apply some kind of lubricant. And then we'll put a telfer pad on, and then that way we can just do a compression bandage until she's stabilized, and then we can address the wound. So we'd go ahead and start with a telfer pad, and we'd put it here.
It's disappeared. I
Get a
haven't
stack of
checked out the
gauze,
computers yet so far.
and place it on it.
Accessible.
And then that way that'll help do our pressure. We got our cast padding. Go ahead and bring it around her. There we go. Okay. We'll go ahead and you want to make sure and apply it relatively tight, but not too tight that it's going to make it difficult for her to breathe. And we have our vet wrap here.
Okay.
And again, using her body to keep the vet wrap tight. Just again, not too tight.
She stood up. No, she's like that. She stood up.
There we go. And then that way, in case she had a bleeding wound, the bleeding would stop. Be able to hold some compression to it until the doctor can address this particular wound. Okay, so I'm going to go ahead and apply a modified Robert Jones bandage to Poppy. Go ahead, because she is smaller, I'm just going to use a 1/2-inch white tape for the stirrups.
I'm about to restart this network. What is it that you need? Prescription labels for my flea treatment?
Go ahead and use a tongue depressor to keep the tape from adhering to itself. So I'll apply the stirrups on the medial and lateral sides of the leg. Good girl. We got my cast pad in here. You're going to apply it at the distal end of the leg, making sure to keep the middle toes visible. That way you can check for any swelling while the bandage is on the leg. And then work your way up to the proximal end of the leg, making sure at least 50% of the cast padding is overlapping. We're going to go up over the elbow. And then making sure we have a sufficient amount of padding.
Oh, hello. We got something going on here.
Okay.
Alright, next we're going to apply our stretch gauze, our clean gauze. We're gonna start at the distal end again. This is where we're gonna create some compression for the cast padding. Again, making sure that we are at least overlapping 50% from the previous passover. Good girl. Then we're going to go ahead and release our stirrups. So you just release it from the tongue depressor, and then you'll just twist it and then adhere it to the clean gauze. We're going to use our vet wrap. Again, starting at the distal end, making sure we're not making this too tight. And this is going to be our protective layer. And continuing with that 50% overlap as we work our way up. And then we are going to leave a thin layer of cast padding sticking at the top, at the proximal end of the bandage. Good girl. Then we're going to use our elasticon. We're going to apply it at the bottom of the bandage. And then this will just help create stability as they're walking on the leg. And for her, we could have used a smaller elasticon.
Oh, here we go. Oh, wait, after you wrote all that. Here, get rid of them. They look terrible.
Okay, I'll just put it over that one because I don't want to try to tear that off.
Okay. Hopefully that fixed it. Yeah.
And then we can go ahead and check the toes. Make sure there's not any swelling or redness in between bandage changes. And then when we remove the bandage, we would start from the proximal end here. And just slowly making our way down. Okay, good girl. Good girl.
There's still no room.
Okay, you're fine. You're fine. Good girl, Poppy.
Yeah, they're done. He just always waits to do the medication and then let him out.
Okay, I know it's part.
No, Emma has it. Okay.
And once we remove the bandage, we're gonna go ahead and remove the stirrups. No, Poppy, I'm sorry, baby. Here we go. Okay, so I'm going to go ahead and apply a splint. So I have just the beginnings of the modified Robert Jones bandage. What I'm going to go ahead and do is I'm going to go ahead and start with my elastic gauze or my clean gauze, starting at the distal end. This is when I'm going to apply to compress that cast padding. Again, overlapping 50% of the previous wrap. And then typically we would have a splint that was exactly cut to her, but since she doesn't actually need one, we'll just use one that we have on hand. I'm going to go ahead and place it on the caudal end of the foreleg. Making sure that her feet or her toenails are not past the end, because we don't want them pressing on the ground. Then I'll go ahead and release our stirrups. This will also help keep the splint in place. Take our tongue depressor off. We'll just go ahead and twist it up and around. Good girl. And we're going to go ahead and use our plain gauze and go up over the splint. This again will help keep it in place.
Could federal be possibly federal? I mean, it could. Probably the bigger one.
Then we're going to use our vet wrap, starting at the distal end. This is our protective layer, making sure that we're not getting it too tight.
I'm gonna put this appointment in just because
Please, thank you.
I'm gonna go.
Going up over the end, protect the whole splint.
Perfect fits.
Go ahead and use our elasticon again for that protective layer as she's walking. And there we are. Now we have a splint in place. And then if the dog has an issue with the splint slipping, sometimes the elasticon can go over the top to help adhere in place. So I'm going to go ahead and perform a dental cleaning. So I have my sterilized instruments here. And then I'll go ahead and put in the mouth gag so it's visible here. So we can go ahead and use the ultrasonic scaler. Okay, ready? So I'm going to go ahead and use the ultrasonic scaler first. With this one, you're going to need to make sure and never use this at a 90-degree angle like this, because it is like a jackhammer and it can damage the tooth. So you want to go ahead and use the side here. And then make sure and never get up under the gums. And then also make sure you have a decent water supply, because this can heat up and we don't want to damage the tooth. So for each tooth, you want to go ahead and just move in a nice smooth motion, and then making sure and not spending too much time on one tooth, because you will damage the pulp. So since this one we're not getting all the tartar off, we'll just go ahead and move on to the next tooth, and then you can come back to that one. And then this is where you're going to evaluate, noticing that this tooth is broken off, so you will make sure the doctor is aware of it. And then you want to start with each arcade, do the buccal side, and then do the palatal side here, and then you'll go ahead and move on to the next quadrant on the bottom of each of them, and then we'll rotate the dog and do the same thing. So then after you're done using the ultrasonic scaler, you will get your hand instruments. This one has a blunt edge, so it is safe to go up under the gums. So for this, you're feeling for any tartar that is stuck up under the gums, and then that way the gums are allowed to heal back down. You will do the same thing. You'll notice that there's a deep pocket here, so again, you'll let the doctor know. You'll do the same thing for all the quadrants, scraping off any tartar that you feel. Then you move on to your other hand instrument. This is has a little bit more of a sharper edge to it. This is what you're going to be doing for the surface of the tooth. So any of that tartar, like this here, we'll go ahead and scrape away. And you're feeling for any any rough edges, that's indicating that there's tartar on the tooth. Then you'll go ahead and do that for every tooth in that arcade. This one is not to go up under the gums. You'll notice that there's a little bit of tartar there. Okay, once you're done doing all of your scaling, you'll go ahead and polish. This is going to smooth any of the edges that you may have created while you were scaling. And then this just makes sure that it's harder for the tartar or plaque to stick to the tooth. So you'll go ahead and get your Profi paste cup and then fill your cup here. Go ahead and start it before you get on the tooth, and then you apply it. You want to do all surfaces of the tooth, and then you'll go ahead and refill for each individual tooth. And then you will make sure and spray away any of that leftover Profi paste. And then we do have the dog angled down, so any of the debris that we get from the teeth or the water is running out of the mouth rather than down the trachea. And then the cuff on our endotracheal tube is also inflated to help prevent any of that. So I'm going to go ahead and do a go home instructions for client after dental. Because they are going home the same day of surgery, they will be a little groggy. So we want to make sure to watch them around any stairs or jumping up on the couch, because they just may not make it like they normally would. As far as extractions, because there was none done today, there won't be any changes in their food. So starting tomorrow, food and water will be like normal. And then the antibiotics, we did give it an injection, so it'll last 2 weeks, so there's nothing you need to give by mouth. And then we always recommend, if you can't brush the teeth, we do have a gel that you can wipe on the teeth at least a couple times a week, will be beneficial. You do have to wait 2 weeks before starting it, because we need to make sure the gums heal before you go around messing with the mouth. So obviously, if you have any questions, concerns with the dog's healing or how they're recovering from the anesthesia, make sure to give us a call.